Hello, everyone. Good morning, and welcome to another AMA with Dr. Behnam. I'm Dr. Ben. I'm a board-certified dermatologist, also one of the founders of Happy Ed. Welcome to our summer session. Thank you for joining us. Just please remember that this information here does not constitute medical advice and should only be used for informational purposes only. It doesn't not establish a patient-doctor relationship. Please do not rely on this information to make medical decisions, and always talk about the risks and benefits of any medical treatment with your doctor before starting treatment. All right, guys, I'm very excited. So let's get started. So, is severe hair shedding normal when starting Happy Ed? I'm having severe hair fall and I'm losing a lot of hair density since starting the product. I'm into my second month. So the product contains minoxidil and finasteride. And with minoxidil, there could be initial hair shedding. This is even true with the non-prescription over-the-counter version. This is perfectly normal. The shedding could last about 6 to 8 weeks, sometimes 2 to 3 months. Patients that shed initially actually have better results. What's going on is that the minoxidil it just resets your hair cycle. So that's why patients shed. And the patients that go through the shedding end up with better results at the end. I've been on oral minoxidil for about 6 months. I have lost lots of hair since I've been on it. Should I continue to use it or discontinue? If it's been 6 months and you've lost a lot of hair for 6 months, and then it's obviously not working, I would probably stop. That's actually very, very unusual. What I would do, I would actually take a photo right now and I will compare with the photos initially. So we have a lot of patients come in and they tell me, doctor, I've been losing hair for like 6 months. What can I do? So we see this all the time in the clinic. But then once I take the photo, and compare it to the first initial photo that we took, we see that they have a lot more hair. So how is it possible that they're still shedding hair and they have a better result? The reason is because the amount of hair you shed and the amount of hair you growth are actually two separate things. And in fact, sometimes when you have more hair, the more you're going to shed. So it doesn't mean that you're shedding hair. That means that you're not growing out hair. So it's really important to compare your results to initial photos that you took, because in majority of those cases, although you're shedding hair, you're still growing out more hair. So sometimes the shedding doesn't stop, but you're going to grow out more hair. So shedding does not always equal not gaining more hair. Is it okay to use derma roller with Happy Ed topical formula? Absolutely, yes. In fact, we recommend it. The derma roller Relax is a 0.25 derma roller. In fact, I have one here. I think last time people wanted us to demonstrate how we use a derma roller. So basically, you just apply the topical on and gently roll back and forth, here, 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 and then right and left, here, here, here. So you want to gently roll it. Don't make yourself bleed. The pressure should be as light as applying like a deodorant. Can you take Nutrafol with Happy Ed? Yes, you could. But I know Happy Ed also have our own very similar multivitamin that we designed that is pretty much very similar. If not, it has certain ingredients that are even more than Nutrafol. So please check ours out as well. And we could probably give you like a coupon code if you want to use it. Is it okay to use hair grooming styling products while using Happy Ed? Absolutely, yes. You can use it, no problem. Any liver issues taking this medication, minoxidil 2.5? Well, it's extremely rare. I mean, we typically don't even do blood tests because we're really not that worried about it. Overall, a very safe medication. I went through the initial shedding when I started the over-the-counter 5% minoxidil last year. Will I have shedding again when I switch over to Happy Ed? If so, how much? So typically, if you already went through the hair shedding once, you're probably not going to go through it again, most probably. So I think you should be fine. But again, there's still some cases that I've heard that even with the over-the-counter, when people switch from the solution to the foam, they go through hair shedding. So, but we're a solution, just like the over-the-counter one, that's a solution. So I doubt you're going to go through it, but there's a slight chance, which is very rare. What if after 2 months of topical and oral dutasteride, I want to switch to finasteride? Do I switch over in one day or have to mix it for a while? No, you could actually just switch right away. It's not a problem. There are also some people, what they do, they like do 2 days of this and 5 days of that, and they kind of like switch over slowly. You could also do that, but I don't think it's necessary. Since summer began, I've gone to a good number of pool parties. I noticed a day after a pool party, my hair seems like it is zapped dead completely, almost making my hair feel thinner and brittle. Is there anything to worry about the hair loss prone people going to swimming in pools when it comes to perhaps to chlorine? So here is the thing. So I don't think obviously being in the water is going to damage your hair. You really do want to wash off that chlorine though, off of the hair. So it's really important to take a shower after after you're done with the pool. That's really important. But for the most part, I don't think it's really that dangerous for your hair. Um, so, uh, what is the extremely best method to actually, honestly and truthfully, regrow the hair back, especially if I've been bald for the past 20 years. So, look, if you are bald, nothing is going to work. I mean, unfortunately. And the reason is because you have no hair follicles there. So, all these products, oral finasteride, oral minoxidil, the topical stuff, only work basically when you have some hairs there. So, if you don't have any hairs there, it's just not going to work, truthfully. I noticed that typically women under 50 are prescribed spironolactone and women over 50 are prescribed finasteride. Why is that? And can women over 50 take oral spironolactone? Great question. So, every company has their own rules and algorithms they go by. So, typically below 50, uh, we don't give finasteride because of the category X and the potential risk of getting pregnant. So, that's why we default to spironolactone. Above 50 is okay, but I think the problem is that spironolactone with females above 50, it could increase your risk of some of the liver and kidney issues. So, and it's a blood pressure medication. So, and we believe actually that above 50, the finasteride could work better. So that's why we prescribe it that way. But if you really wanted, you could actually message your doctor and see if they're willing to write it for you. What are your thoughts about taking topical latanoprost with a super capsule? Yes, it's great. I think our new Happy Head formula does have the topical latanoprost. Didn't that just got published on the
There is a
website?
latanoprost, yes.
Yes, we do have a topical Happy Head that has that, but you definitely could take a super capsule with a topical latanoprost. That's no problem at all. Once you have started using the topical minoxidil with finasteride, how many doses can you miss before gains in hair growth are lost? I mean, obviously, a day or two is not going to make a difference. I mean, it probably takes many, many days. I mean, you could probably be off the medication for almost a month and you should still be good. But yeah, so 1 or 2 doses here and there does not make a difference. Is finasteride 1 milligram and minoxidil 1.25 milligrams safe for women to take? How does this compare to spironolactone 25 milligrams and minoxidil 1.25? So, great question. So, first of all, you are describing uh, both of our super capsules. So, we have a super capsule for males, which is the 1 milligram finasteride with minoxidil. And today, actually, we just released the super capsule for females that combines spironolactone with minoxidil. So it depends. If you're female above 50, you could definitely take the finasteride with minoxidil. If you're female below 50, we typically recommend doing the spironolactone with minoxidil. I truly believe that minoxidil is a superior drug compared to spironolactone. But when you mix the minoxidil with spironolactone together, you get both the testosterone blocker and the vasodilator. For the male super capsule, the finasteride is also a testosterone blocker, and when you have the minoxidil, it's a vasodilator. But I do believe that the finasteride is a better drug than the spironolactone. Using your oral minoxidil tablets to great effect, considering also taking dutasteride orally as well, but wondering if the zero point 0.3 topical dutasteride is meant to be applied once or twice a day. The topical dutasteride is meant to be applied twice a day. So if you're currently using the oral minoxidil and you do the topical dutasteride with mint, that will be really good. You're gonna get great results. And if you even start doing the oral dutasteride, you even will see even better results. Remember, guys, when you do something topically and orally, you will see better results as long as you don't have side effects. Our recommendation is that start one, see how you do, make sure your body does okay, and then add the other one. Is it okay to use my formula while my hair is still wet after shampooing? Absolutely, no problem. should I be applying only to the affected area or my entire scalp? I would recommend to only mainly the affected area, unless you really feel you're thinning in the other areas, but mainly to affected area. Can wearing a hat harm my hairline? Typically not. Typically it does not, unless like it's really really tight in the front, which most hats are not. Are there any ingredients in scalp scrubs or sunscreens that I should be avoiding during summer months? No, just wear your sunscreen. Are there any specific foods I should eat to help my hair growth during the summer? Great question. So we know that increasing your protein uptake is important. So adding more avocados, cashews, nuts, that's great. Chicken and fish are also great as well. Again, avoiding the whey protein isolates, avoiding creatine, um, avoiding energy drinks, anabolic steroids. Those are the stuff that you want to avoid in general. Anyways, French, do you mind giving me some water? Is it possible to switch between using a topical treatment and oral treatment with the same ingredients to avoid scalp irritation during the summer months? Yes, I mean it's possible. We really don't like people. Thank you. We really don't like people to constantly switch on and off. Uh, but if the topical is very irritating, then you could definitely go on the oral in order to avoid that irritation. And again, we have super capsule, which will help quite a bit. Are there specific ingredients I can remove or add to my topical treatment to help manage irritation? Yes. So if let's say you're getting very irritated from the topical, there are a couple options. Number one, you could use a leave-in conditioner after shampoo, so that will reduce the irritation. It's called a leave-in conditioner. As a guy, I don't know what it was. It's basically a conditioner that you put on your scalp as the last step before you basically come out of the shower, and it's soothing and reduces the irritation. You can also purchase topical scalp serums that are just hydrating serums that will reduce irritation. You can also just wash off the product after 2 hours. So let's say you put on at 8 o'clock at night, by 10 o'clock you could wash it off and take a shower, and you're not really lose much efficacy, but that will reduce the irritation because you're reducing the amount of time you're leaving on the scalp. Also, we can change some of the formula, so we could reduce sometimes the minoxidil concentration or take out the retinoic acid, so those will help with the irritation. Also, we do have our Aquas water-based formula. We haven't talked about that in a while. Our water-based formula. So our water-based formula really does not have much alcohol in it. They have reduced the alcohol concentration by 80%, so it is less irritating. So if the topical is causing a lot of irritation, request you could customize the formula. Just reach out to help@happyhead.com, or you could get the water-based formula. Just ask the Happy Head front office desk. Should I be drinking more water during summer months? I don't think it really matters. You should be drinking more water, but I don't think it really affects the hair. What do I do after 6 months of treatment? So typically, just like with any other hair formula, if you get good results and if you stop, the results will go away because because we're at a constant war with our testosterone in the body. So after 6 months, please continue to maintain the results. Will the oral medication fill in the hairline? I mean, depends. Sometimes yes, sometimes no. I mean, it all depends. So, but it could. It potentially could. It all depends upon the density that you still have on the frontal hairline. Now, sometimes if you take the oral and apply topical, you're gonna see better results in the frontal hairline, especially if you use it with the derma roller. Um, So let's see. Are derma rollers safe? Can it damage hair follicle? Well, I mean, you could use anything to damage anything. I mean, look, give if you give a cotton paper towel to my kids, and they will somehow find a way, to damage themselves with it. So the answer is yes. So you have to be careful. Again, the key with the derma roller is that they come in different. They come in different lengths of the roller, these spikes. So the ones we recommend is a 0.25 depth. And when you apply the topical, gently roll back and forth and constantly be moving around. So one way you could damage your hair is that if you're very aggressive or you use a very high, the depth of the needles are very thick, like a 1.5, and you really aggressive go back and forth in the same area, absolutely you're going to cause scarring basically to your scalp. So that is not what we're recommending. We recommend using a 0.25 depth. Apply the topical first. Be very gentle. Don't make yourself bleed, and constantly be moving it around. Don't be in the same area continuously. Thank you so much for that question, by the way. Uh, so I've been using the water-based formula for a year now. I started to develop a terrible irritation along the temples over the past few months. That Happy had changed the ingredients. The irritation didn't happen in the first 6 to 8 bottles. Would you suggest changing to an oral version instead since the reaction keeps recurring for the past 2 bottles? So I will look into that. I know we have not changed the water-based formula, so I don't know why you're getting the irritation. This is the first time I'm hearing about it. You could definitely switch over to to the or sorry, you could definitely switch over to oral medication. Um, And again, if you touch it up slowly, the rest of side effects will be less. Why don't you reach out to our assistant, Francesca, and she will also help you look into the water-based formula to make sure there's no issues. Also, we could probably maybe remove or lower some of the concentrations and customize it for you to get rid of some of the irritation, but we'll definitely look into it. But yes, if you're constantly getting irritated, then switching to oral would be best. Touch it up slowly, which means don't take the pill every day initially. Just start with 1 tablet like week 1, then two tablets week 2, then 3 tablets week 3. By doing that, you will reduce the side effects. I have great silver hair. This product is making my hair orange yellow. How can we change this? My focus is mainly on the frontal hairline. So please reach out to Happy Ed and tell him to remove um, the retinoic acid. It's the retinoic acid that has this yellow color, and also potentially the aloe vera too. Aloe vera. Yeah, potential. So please reach out to Francesca, who she's right here. She's the one who helps me coordinate basically all the AMAs. Remove the aloe vera and the retinoic acid. Help at happier.com. Uh, I'm gonna have Francesca also try to reach out to you. Yes. Okay, thank you. Thank you for that question. I've been having started from the tutasteride formula in Happy Ed. Can I cut it back to zero point 0.5? Yes, you could customize it. Please reach out to Happy Ed and they will help you customize it. And then you should probably take a week or 2 off and let the side effects go back to normal and then restart again. Just start it up slowly. So let's say you do it like 3 times a week, like twice a week, and then 3 times a week, and then 4 times a week. But let's say if you get to head 5 days a week and you're having side effects again, go back to 4 days a week. So you want to go to the level where you're not having side effects. I applied the formula at 7 p.m. I wake up for a whiz at 4 a.m. I apply the second dose. I shower at 6 a.m. I'm ready for work. Am I killing its effectiveness? No, absolutely not. You're all good. You're all good. You could wash off the product after 2 hours. What about using red light therapy during oral minoxidil? So red light therapy, look, in my opinion, look, it doesn't work for everyone, but it could certainly work for some people. I know we've been saying this for a long time that Happy is coming out with our own version. We are. It's just taking a while because we want to make sure we get the perfect product for you guys. Also, how quickly will you increase the minoxidil up to 2.5 to 5 milligram, which seems to be the most effective range for men? So actually, that's not necessarily true. So in my office, personal office we're in West LA. I probably have thousands of patients on oral minoxidil. I'm probably the number one oral minoxidil prescriber on the entire West Coast. And majority of our patients, 97% are on the 2.5 milligram dose, and they see really good results. So going to 5 milligrams is not for everyone. As long as you're not having any side effects, you could definitely do it. But I would definitely give it a few months to make sure you don't have any side effects before you're up to the 5 milligram dose. And also, my recommendation would be to please purchase a blood pressure cuff. Just on Amazon, it's like $30, $20, and measure your blood pressure to make sure it doesn't drop it. Thanks for the Q&A. For retinoic acid, I read online that some people get irritation from this during the summer months. Have you seen this in your practice or just another Reddit-made issue? So the retinoic acid could cause some irritation, and you can certainly remove it. I mean, we're a fully customizable product, so you can reach out to help at happy.com and say to remove the retinoic acid. The reason why it may cause irritation because retinoic acid, when it comes to sun, it may cause some irritation. Again, ours is but again, if you feel that's causing irritation, you could certainly have it removed. Just reach out to Happy Ed. Losing hair from the crown, in your opinion, how long will it take with the medication to see results? Typically 4 to 6 months. What if after 2 months on topical and oral finasteride, I want to switch to finasteride? Do you need to switch one at a time or have it mixed for a while? You could just switch Don't worry about it. Just do the switch right away. You should be fine. But just keep doing the topical though. Can I get a prescription for cranial prosthetic from Happy Head, or do I need to see a doctor in person? I think you need to see a doctor in person. We don't prescribe that. Have I been? I've been taking topical. I've been taking a custom topical solution for about 4 months. Can you tell me how long before I should see measurable results? It's usually about 4 to 6 months. I would definitely wait the 6 months, because not everyone's going to see the results in 4 months. And if you don't see the results by 6 months, definitely reach out to us. And in those cases, it might be a good idea to go like add an oral medication. So this is what happens all the time as well. Patients come to me in my personal office and they've been on oral finasteride for 2 years or for 5 years or 6 months or 10 years, and they're not seeing any improvements. The results have plateaued. So doc, and they tell me, doc, I want to go on the topical Happy Head, but should I stop the oral? And my answer is no. Do not stop the oral. See, because that oral is still helping you a little bit. And we know as a fact that when you combine the two together, topically and orally, you're going to see better results. So, and the vice versa is true as well. If you've been a topical and the results basically plateaus after a while, don't just stop the topical. Add an oral medication for basically to see better results. I've gotten a rash from other sprays from Keeps. Can I use Happy Head with confidence that the rash won't occur? No, the rash could still occur. So the rash. So okay, so the sprays that Keeps has, and Keeps also has similar formulas that we do. They have minoxidil in it in an alcohol base. So the rash could come from the minoxidil, it could come from the alcohol, it could be from anything. So we don't exactly what's causing the rash. So if you want to be on the safe side, I would probably try to custom either go with a water-based formula that has a much lower alcohol concentration, and or you could customize it where you have a lower concentration of minoxidil. So as opposed to 8%, now you could do the 6% and remove the retinoic acid, and also don't do it twice a day. Maybe do it once a day initially to make sure you don't get a rash. And if you do get a rash, reach out to us and we'll try to figure it out. We'll just put you on the water-based formula to avoid that rash. My family has a history of heart condition. Do you recommend a heart exam before trying the super capsule? If so, which heart exam should I ask for? So that's a good question. If you do have a history of heart disease, you should definitely just see your regular doctor and say, look, I want to go on oral minoxidil. Please check my heart. So your regular doctor or your basic cardiologist could do it. I think that's a good thing to do. Typically, when patients come to my office, I always screen them. Do you have any history of heart disease? And some patient will say, look, I have a history of heart palpitations. I always say, ask your doctor first, get approval before you go on the medication. Is it bad to use hairspray? I mean, it's not bad. I mean, you don't want to use it all the time. I mean, a lot of those are just chemicals, but it's not bad, but I just want to overdo it. The formula leaves my hair stiff and dirty feeling. Is this normal? I'm applying too much. So, it is. So it is the aloe in the product, and sometimes the minoxidil that could give you that feeling. You could actually buy a hair serum, like a hydrating hair serum on Amazon, and apply it right on top of it, and that will help quite a bit as well. Um, how do you ensure the drug product maintains stability when shipping during these hot summer months, specifically temperature reaching 90s to 100? So that's a great question. So we had done like a lot of studies in our own lab here, where basically we dropped the temperature quite a bit and basically increased the temperature as well quite a bit. And so the summer months, actually, the increase in temperature, it's perfectly fine. I mean, it doesn't do anything to the product. The temperature that could damage the product sometimes is the cold temperature. So we have the issues during the winter months. So if it's really cold, it could cause some of the products, like the minoxidil, to precipitate out of the solution. So sometimes you see these crystals at the bottom, which is not a big deal. But if sometimes the whole bottle just crystallizes, then then it's basically useless. So you have to let us know, and we'll replace that product. So summer months, the 90s, 100s is not a big deal. When we're testing, I think we increased the temperature way like really, really high. So, and also when it's outside 100, the bottle does not reach like 100 degrees. So you're going to be fine in the summer months. It's the colder months that we're more worried about. Can I use other products on top of my product to keep my hair from drying out, like essential oils. Absolutely, you could use oils, no problem. Are there any topical products or ingredients we should avoid when using the formula? Um, I mean, not really, no. After first bottle, I have a break of more than a week because your pharmacy which couldn't mail me a refill on time. Also ordered super capsule. I'm already waiting for the third week to receive them. Change the pharmacy for a more responsible one. Now I have to start all over again. So I apologize for that. We are very sorry. We did have a slight glitch a few weeks ago that we had to work through. So I'm so sorry about that. Uh, I'm gonna have Francesca reach out to you, and we'll get it fixed. Francesca will reach out to you. Thanks so much for letting us know. We really appreciate it. We're really trying to work really hard on customer service. We're trying to work really hard to get the products out on time. Literally, our pharmacy staff, they get there at 3:30 in the morning to ship the products out. So, but sometimes glitches unfortunately happen, and sometimes the prescription that may not reach the pharmacy, and that's what happened. But thanks for us for letting us know. Um, what can I use to protect my uh, basically my scalp from the sun? So wear a hat, wear a hat, and also you can also apply sunscreen on the scalp as well. What is a good product to heal the scalp? So I don't understand that question. What is a good product to heal the scalp? I mean, if you're getting irritation, you could definitely use essential oils or scalp serums basically to reduce some of that irritation. Can I use Happy with other products that claim to grow hair naturally? Example, plant-made products? Sure, no problem. What is the purpose of retinoic acid and hydrocortisone? In clinical studies, retinoic acid has been shown to increase the penetration of the minoxidil, thus making it work better efficacy. The hydrocortisone reduces some of the irritation from the minoxidil and the alcohol in the product. It's a very low dose over-the-counter hydrocortisone. But if you don't like the retinoic acid and hydrocortisone, please reach out to us, and we'll be more than happy to take those out of your formula and ship you another customized formula with your name on it. Does it make a difference? Does age make a difference in growing hair back? Yes, it does. The reason is because the older you get, the more miniaturized the hair gets. And if you pass a certain miniaturization point, the hair will never come back. So age does make a difference. But that being said, we have patients of all ages actually using our product. As patients as young as like 20, as old as patients in their 70s and early 80s. So again, it all depends on your hair density. So age does make a difference, but more importantly, is your hair density. Alopecia universalis. I have been using the minoxidil finasteride pills. I'm seeing some growth in the facial hair around my beard and mustache areas. So this is great. I'm very happy to hear this. What I want to see more than anything else is the regrowth of my eyebrow. Is there anything that I can do to speed up this process? So you could get Latisse. I think we just launched our Latisse product.
Not yet.
Not yet, not yet. So you get Latisse on our website, and also you could get. We are coming out with a special type of minoxidil for the eyebrows that can't happy and you cannot use on the eyebrows. But we come out with a special minoxidil that you could use on the eyebrows. So you could use the minoxidil happy product for the eyebrows once a day, and the Latisse other like another times during the day. But I'm very happy that it's working for you. And those products will be released soon, and they will be on our website soon. So please be patient. Thank you. Does oral affect other medications? So typically the oral minoxidil, it's a blood pressure medication. It could have some interaction with other medications. So for example, if you're taking other blood pressure medications, so please run it by your doctor, or please definitely list it by our doctors as well, and they review it as well. Um, when using Happy at night, I notice that my eyes are puffy in the morning. Any suggestion? So the reason why that is because you're getting some of the Happy on the pillow, and that's causing some irritation around the eyes. I don't have much suggestion for that, unfortunately. If it continues to happen, you probably may have to take the minoxidil out of the solution or lower the concentration. So, but why don't we first start by lowering the concentration? So reach out to help at Happy and lower the concentration, please. When you increase the percentage of topical or change the topical to another, do you lose the hair you have grown and have to start over again? No, you should not. I mean, you don't usually lose it. So, and you're not starting from beginning. I've been using Happy for almost 3 months, and I wake up with deep itch at a particular small spot, which eventually goes away. Can it be the formula? I mean, it's possible. It's possible it could be the formula, but only why in one area, a small area. That doesn't make sense. Usually, if the product is going to cause irritation, it's going to happen everywhere, not just in one small area. Uh, what and so for that, you could buy some hydrocortisone on the counter and maybe apply to that area and see how you do. Obviously, if it continues, reach out to Happy It, and we could probably customize a formula, one that doesn't have retinoic acid and it has reduced minoxidil to 6%, and see if that helps. What does the retinoic acid do for the scalp? What it does, it increases the penetration of the minoxidil, making it work better. It is also the one that actually gives a little bit of an orange yellowish hue. So if you don't like the retinoic acid, let us know and we'll take it out. Can retinoic acid cause irritation? Sometimes it could, although the concentration of retinoic acid in our formula is not very high, but it could certainly lead to irritation. It could also certainly lead to sun sensitivity. Again, if it's irritating you, please reach out to Happy and we'll take it out for you. For people of color, should I wash my hair every day? Because washing every day dries out the hair. Well, you don't necessarily have to wash every day, but putting the product in your scalp could dry it out. Uh, but you don't necessarily have to wash it every day. Okay, so let's see. Do you recommend washing your hair with shampoo every day or every other day? I typically recommend every other day, but you could still wash your hair but not use a shampoo. Um, I'm another customer who has been unable to get the product. I've called multiple times and still not resolved. I apologize about that. Uh, I'm gonna have Francesca get in contact with you right away, um, and we're gonna take care of the issue today. Thanks so much for letting us know. Again, we did have a glitch, an IT glitch, and that was the cause of the problem. Well, guys, I think that's all the time we have today. Thank you so much for joining us. And again, don't forget to join us on August 1st for our next session. For those patients that are new, customers that are new, you could use the promo code AskDrBen60 and you get 60% off. And if you're a current customer and you would like to order a bulk order of 3 more bottles, you could get 50% off as well when you call the customer service to place the order. Again, sorry about some of the glitches we had, but we are literally adding more customer service every day. I think we're up to like 30 or 40 customer service. So we've literally doubled in size in the past 1 month. We are here. I truly believe that customer service is the most important thing, and we're really trying to address that issue. Again, and we also really do appreciate if you guys could take a moment and write us a review on Trustpilot or on Facebook. We really do appreciate that. And guys, thank you so much for joining us. Again, thank you so much for Francesca and the rest of the Happy Head team. I'm Dr. Ben Behnam. I'm one of the founders of Happy Head, and thank you for all you guys to really helping us achieve the success that Happy Head has achieved in the past couple of years. We'll see you on August 1st for another AMA. Have a nice day. Bye bye. We're gonna